communication plan for snubbing out low birth weight. In the 2017 Kids Count report, the Annie Casey Foundation reported that 7.9% of babies are born with low birth weight in the state of Oklahoma, which means that almost 1 out of every 10 babies are born underweight in Oklahoma. Low birth weights can contribute to developmental delays, as well as both short and long-term disabilities. Low birth weight babies are also at a greater risk of dying within the first year of their life, according to the 2017 Kids Count report. To improve the health of children in Oklahoma, we must focus on decreasing the number of low birth weight babies by engaging communication focused on smoking cessation, geared toward young women, women who smoke, and reproductive health care providers. In this presentation, I will address the problem of low birth weight in Oklahoma, my communication plan based on the theory of planned behavior, snub out LBW, to help decrease the rate of low birth weight babies in the state, and the reason that my plan will succeed. Low birth weight is a complex problem that is related to a variety of factors, including race, age, multiple births, and the mother's health. The Children's Hospital of Philadelphia defines low birth weight babies as babies born under 5 pounds and 8 ounces at birth. This can occur in babies that are born prematurely or in those with other environmental factors that contribute to weight at birth. One of those factors is smoking during pregnancy. The Annie Casey Foundation cites smoking during pregnancy as, quote, the single most important known cause of low birth weight. Researchers find that smokers are nearly twice as likely to deliver a low birth weight baby as non-smokers. The issue of low birth weight impacts babies born in the state, healthcare providers, and families of babies born in this category. It impacts low birth weight babies because, as stated before, these babies have a greater likelihood of developing long-term disabilities and may not even live through the first year of their life. The Children's Hospital of Philadelphia lists oxygen levels at birth, inability to maintain body temperature, difficulty feeding and gaining weight, infection, breathing problems, neurological problems, gastrointestinal problems, and sudden infant death syndrome as issues caused by low birth weight. Healthcare providers are impacted because, as the Children's Hospital of Philadelphia reports, nearly all low birth weight babies need specialized care in the neonatal intensive care unit until they gain weight. It impacts parents and families of these children because health issues associated with low birth weight are costly both emotionally and monetarily. These health issues can expand past just the first days of the child's life, especially if the parents continue to smoke after the child is born. The implications of low birth weight can create developmental delays and other issues throughout the child's life, and secondhand smoke can create further issues for a child's health later in life as well. This is a concern for all Oklahomans because healthy children promote a healthy future for our state. Over the past 5 years, the percentage of low birth weight in Oklahoma has remained relatively stagnant, according to the 2017 Kids Count report. With this issue impacting so many children each year, something needs to be done now to help decrease the number of low birth weight babies in Oklahoma. Snub Out LBW seeks to do just that by promoting smoking cessation among 4 major groups: young women, women that are pregnant or trying to become pregnant and that smoke, and reproductive health care providers. This plan focuses on motivating pregnant women to quit smoking and providing them the resources to do this successfully, starting anti-smoking messages at a young age for women to decrease the number that start smoking in the first place, and finally educating reproductive health care workers and OBGYNs in smoking cessation techniques to help their patients quit smoking. According to Corcoran, the UK government Choosing Health, Making Healthy Choices Easier white paper identifies one fundamental and important problem with health messages. That it is not a lack of information in health, but that is inconsistent, uncoordinated, and out of step with the way the public live their lives. This indicates that that theory about human behavior should guide health communication to fit the way that people make decisions in their daily lives. Asian's theory of planned behavior states that people make behavioral decisions based on 3 factors: The first is attitude to behavior, or their perception of the risks and benefits of the behavior. The second is subjective norm, which is the same thing as social pressure. And the third one is perceived behavioral control, or the perception that they have the ability to change their behavior or control their behavior. For each target audience, the communication messages and channel will vary. For young women, the plan will focus on an "it's not cool to smoke" message that emphasizes cost, health impacts, and social impacts of smoking. This message, in the context of the theory of planned behavior, has elements of subjective norms because it provides some social context to the action of smoking and also helps shape attitudes to the behavior of smoking by outlining the risks of the behavior. The primary channel for this message will be a social media campaign on Twitter, Instagram, and Snapchat. For women that are pregnant or trying to become pregnant and that also smoke, the message will be focused on both education about the effects of smoking on health of the mother and babies, but will also provide resources to aid in motivating and allowing them to stop smoking as soon as possible in their pregnancy or before their pregnancy. This will be done through mommy blogs, social media information distributed through pregnancy centers and healthcare providers in the form of brochures, and support groups to help women quit smoking. This message also incorporates elements of the social norm by including the discussion of smoking cessation in mom groups and blogs. It also incorporates attitudes towards behaviors by providing risk factors for the mom and the baby. Finally, it gives the perception of behavioral control through support groups to help moms quit smoking. Finally, for the reproductive health providers and OBGYNs, the message will focus on education on how to walk pregnant moms and women that want to become pregnant through smoking cessation. The channels will be industry-specific magazines and educational sessions at continuing education conferences in Oklahoma City and Tulsa. The messages for healthcare providers give them perceived behavioral control because it provides education needed to take control of low birth weight in the state. In order to change the issue of low birth weight in babies, we need to focus on one of the known causes of the issue, smoking. If we are able to reduce this cause, less babies will be born with low birth weight over time. The theory of planned behavior provides a framework which will help the success of SNBOUT LBW by focusing on behavioral change. We can prevent one of the major causes of low birth weight in children. Thank you.